now to Dr. Jane Morgan. She's the executive director of the Piedmont Healthcare COVID Task Force in Atlanta. Thanks, doctor, for being with us. So your reaction to these new CDC guidelines, just as Omicron is surging across the country?
So I think what we see in from the CDC here in the United States is the CDC trying to strike a balance between science and commerce, keeping our business running, and also trying to manage an unruly and impatient and exhausted public. And so when we look at this data, we see that the infectious period generally is 1 to 3 days before the onset of symptoms and then tapers off after that over a period of 7 days. So really a total period of 10 days. But the most infectious period is right there in those 5 days. And so if the American public can adhere to an honor system and actually wear a mask after the 5-day isolation or quarantine period has ended, then this will absolutely make sense. But that question is if we can adhere to an honor system. If you can remember back in May of 2021, CDC stated here in the United States that the vaccinated could remove their mask, but the unvaccinated also removed their mask. And we saw an increased surge then in our cases. And so whether we will be able to adhere to this honor system or not remains to be seen.
But would you be comfortable even with a masked person recovering from COVID, but still technically infected with the virus? I mean, if you were in close contact with someone wearing a mask, but still technically positive?
And these are great questions. And I think what we need to talk about with regard to that and answering that question is, as long as the quality of the masks are good, and we need to begin to talk about medical grade masks, either these N95s, K95s, or triple layered surgical masks. If that person is wearing a mask and the other person, let's say it's me, also wearing a medical grade, surgical grade mask, and they are beyond 5 days from their infection, I think it is relatively safe. Certainly, we're looking at people who are vaccinated or boosted, absolutely safe. I will admit there is a rather thin data on the unvaccinated and what is their period of infectivity. And so we see in this CDC guidance that they use the word strict for the unvaccinated. There must be strict mask adherence. What that actually means and how it's actually going to be interpreted remain to be seen.
Yeah, and enforced as well. I want to ask you about the number of hospitalized children in the United States, because we're seeing similar trends all around the world. 2,000 hospitalized kids with suspected COVID or COVID versus 700 last month. Why are we seeing so many more children sick enough with COVID that they need to go to the hospital?
And I think we still have so much to learn about this particular variant, Omicron, that we know is more contagious, more transmissible, and has the ability to evade our vaccines and our vaccination status. What I haven't seen data on yet is what is the vaccination status of these children, whether they are vaccinated or unvaccinated. Certainly, we have seen an increase in admissions in children and also younger demographics, 18 to 29, 30 to 39-year-olds have quadrupled in cases. And also we see that being paralleled with regard to hospitalizations. And so this Omicron variant, we still have much to learn about it with all of these mutations right here on the spike protein.
And let me ask you about the booster, because, for instance, in a country like the UK, where I am, about half of vaccinated people have been boosted. We've been told that 75% effectiveness against Omicron for boosted individuals is pretty much what they can expect. But do we know for how long that protection lasts before it starts waning?
So we do. We see really good data coming out now, and it looks as if we can depend on the durability of that in the UK and other places around the world to be about 10 weeks after that booster before it begins to wane. So not an exceptionally long period of time. And that's why I believe we see countries like Israel looking at whether or not it's time to move forward with a fourth dose as we continue to try to prep and armor ourselves against these ever evolving variants. Don't forget, all of the vaccine companies developed their formulations for the vaccines against the ancestral strain, the
Yeah.
original strain coming out of Wuhan. We are now thousands of mutations in multiple variants, five of which have been variants of, at least four of which have been variants of concern: Alpha, Beta, Delta, and Omicron. And so, what the neutralizing antibodies will be against these variants as they emerge continues to have to be tested each and every time. And so, 75% is where we get if everyone is boosted, and then perhaps some waning after 10 weeks.
But I've heard so much fatigue, vaccine fatigue, from people who are vaccine enthusiasts and who, for instance, had a bad reaction to the vaccine because they spent a couple of days in bed with fever or flu-like symptoms. And they're saying, look, I've taken 3 jabs. I don't know if I could want a 4th one. I mean, is it going to be tougher and tougher to convince people to potentially every 6 to 8 months to go back for another jab?
Hala, such a great point. This hill is getting steeper and it is not leveling off. And we have to think about that when we think about the unvaccinated who continue to hold the rest of us hostage. All of these variants continue to develop in those who are unvaccinated as the virus seeks the easiest route, the most available host. And then that means that those of us who are vaccinated have to be concerned with whether our vaccines are going to be effective against whatever the newest strain that is going to develop in the unvaccinated community. So we must continue our communication efforts with people who are unvaccinated, and we must also begin to identify how we can keep the rest of the public safe, because you're right. I think fatigue is a very polite word to say people are exhausted. Yet another shot, another shot, another shot. What is the end game for this?
Yeah, absolutely. Dr. Jane Morgan, thanks so much for your time and your expertise. Really appreciate it.
Thanks, Hala.